Bet this is probably going to be like a multi-part series. Let's first talk about hypovolemia and hypervolemia. Hypovolemia is 25% or less volume in your body, in the pipes. Remember, your blood vessels are the pipes that carry your blood and your volume. And then hyper is more than 100%. I'm going to talk about how it affects the body in 7 ways. Cardiovascular, respiratory, neuro, renal, skin, GI, and your labs. Your labs. Hypo, oh shit, too low. So what is cardiovascular? What's going to happen? You're going to have an increased pulse rate. You're going to have a thready pulse. Like you're like, is it even there? You're going to have a low blood pressure, orthostatic hypotension because there's not enough volume in the pipes, right? Low volume, lower pressure. You're also going to have diminished peripheral pulses, and you're going to have decreased central venous pressure and possibly dysrhythmias. Now, respiratory, increased respiratory rate and depth of receptions. You're going to be short of breath. Neuro, you're going to have a decreased central nervous system activity. You're going to be like lethargic. You may be feverish, depending on how much fluid you've lost, and you may have skeletal muscle weakness if you've lost more than half of your volume. Now, renal, you're going to have decreased output. There's not going to be enough waste to create, so you're going to pee less. Skin, you're going to have poor skin turgor. You're going to go like this, and it's just going to stay there. You're going to have dry mouth. GI, decreased motility. It's not going to be moving the stuff through the stuff, right? You're going to be constipated and decreased weight because of the decreased volume. Now, blood. What's going to happen in our labs, guys? We're going to have increased osmolality. We're going to have increased hematocrit, increased blood urea, or the BUN is going to be high, increased sodium level because you're just going to be more concentrated, and the specific gravity of your urine is going to be high. Hypervolemia, you're going to have a bounding pulse. You're going to have an increased pulse rate, increased blood pressure. Respiratory, you're going to have an increased respiratory rate, shallow respirations. Also could be short of breath, dyspnea, and have crackles when you listen to the lungs. Neuro, altered level of consciousness. You're going to have visual disturbances. And urine, you're going to have increased urine output. You're just going to make more urine. You're going to have pitting edema where you go like this into the legs, especially the feet, and you're going to be like, it just stays there. You're going to have increased motility in the GI tract, which could lead to diarrhea, increased body weight because of all of the volume, and liver enlargement and ascites in that area. Now, blood, what's going to happen in the labs? You're going to have a decreased osmolality, decreased hematocrit, decreased BUN levels, decreased sodium, and decreased specific gravity. That's what happens in the body for that hyper and hypovolemia. Part 2.